Mitchell Roman, a 21 years old cricketer, complains of right shoulder pain, on and off pain. So for several weeks. So he noted that whenever he trains hard, his pain is increasing. So the pain is mentioned to be short with movement, and at rest it is much more worse. Short to throw even at rest. So it is painful for him to actively abduct his right shoulder to 30 degrees. So it is tough for him to abduct his right shoulder to 30 degrees. The pain is worse against resistance. So he has minimal tenderness to palpation over the bony prominence of his shoulder. Strength is 5 by 5. Sensation is intact. He has full active range of motion in external rotation, internal rotation, flexion, extension. The muscle that is most likely injured in this patient is innervated by which nerve? So they are talking about, this question is very typical. He is playing right shoulder pain on and off at worst intense exercise. This is a problematic thing. He's having pain at something around 30 degrees Celsius right shoulder. So he's not able to lift his hand completely. So this pain, even with resistance, the pain is getting worse. So this all means the rotator cuff muscle is severely damaged in this patient. So the MCQ is indirectly asking what nerve is innervating the rotator cuff muscles. So it's going to be suprascapular nerve. The answer here is suprascapular because the first 30 degrees of shoulder abduction is because of suprascapular nerve. Okay, so the rotator cuff muscles, if you see, the rotator cuff muscles are subscapularis, teres major, teres minor, and supraspinatus. Okay, these are all the rotator cuff muscles. So out of which suprascapular is very, very important for your MCQ. So suprascapular nerve innervates the supraspinatus and infraspinatus muscle. So damage to suprascapular nerve is going to cause rotator cuff dysfunction. Now, there is another MCQ. The most commonly affected nerve in rotator cuff injury is going to be supraspinatus. Supraspinatus, the most commonly affected muscle in rotator cuff injury. Most commonly affected in rotator cuff injury. Please make note of this question. Then rotator cuff muscles are, there is another MCQ, supraspinatus, infraspinatus, teres minor, subscapularis. This is the next MCQ that you need to know. So 3 MCQs we saw here. Out of this, very important point that you need to know is the supraspinatus. The supraspinatus is the one that initiates the first 15 degree of the movement. Initiates abduction. Initiates abduction, the first 15. Then after that, almost till 90 degrees, it's your deltoid. So till 90 degrees is your deltoid. Above 19 degrees, more than 90 degrees, almost till 180 degree, above 19 degree is going to be your trapezius and serratus anterior. Trapezius and serratus anterior. Okay. So at 90 degree, deltoid stops. Why? That is MCQ. Humerus bumps. Okay, that is a problem. So humerus bumps to the acromion. So these are the key words you need to know to sort out any kind of MCQ that is asked in this question. I will repeat these points. So in a rotator cuff injury, supraspinatus is most commonly affected. That is first MCQ. The rotator cuff muscles, this is second MCQ. Supraspinatus, infraspinatus, teres minor, subscapularis. Out of which the subscapularis is going, the supraspinatus is going to initiate the abduction. Supraspinatus is going to initiate the abduction. So here in your question, they talked about the first 30 degree. So the first 15 degree to 30 degree almost is going to be because of the supraspinatus. So the beginning of abduction, that's what they are trying to ask. So abduction begins at with the help of supraspinatus. Then it continues almost to 90 degrees at deltoid. There it stops. Why? Because humerus bumps into the acromion. Very important MCQ. Humerus bumps into the acromion at 90-degree movement of your shoulder. Then, after 90-degree, so trapezius and serratus anterior takes over the deltoid and it makes further movement. That is more than 90-degree trapezius and serratus anterior. Is this MCQs? You got 5 MCQs from here. Is this clear? So this is other than what is given in the MCQ. So 5 more MCQs here. Is this clear?